Good afternoon and welcome to the Fiscal Year 17 Justice and Mental Health Collaboration Program Orientation webinar. First off, we just want to say congratulations to you on the Justice and Mental Health Collaboration Program, or as we often call it, the JMHCP Grant Award. We know that it's a very competitive process and that it takes a lot of effort for everyone to put together these fantastic applications. On the webinar today, we'll have a bunch of different folks who are going to speak to you. First off, we have myself. My name is Sarah Wurzberg. I'm a Deputy Program Director for Behavioral Health at the Council of State Governments Justice Center. We also have Maria Fryer, who's the Justice Systems and Corrections Policy Advisor for Substance Abuse and Mental Health at the Bureau of Justice Assistance in the U.S. Department of Justice. We also have Dr. Richard Cho, who's the Director of Behavioral Health at the Council of State Governments Justice Center. In addition, we have Nikisha Love, who's a Policy Advisor at the Bureau of Justice Assistance in the U.S. Department of Justice and leads their work on the JMHCP. We also have Dr. Cassandra Carter, who's the Performance Measurement Tool Training and Technical Assistance Coordinator and Help Desk Task Lead for the Bureau of Justice Assistance. So we want to welcome all of them and thank them for participating on this webinar. I'm going to hand it over to Maria Fryer to give you a bit of an information about the Bureau of Justice Assistance.
Thank you, Sarah. Good afternoon, everyone. My name is Maria Fryer, and I'm a Policy Advisor for the Justice and Mental Health Collaboration Grant Program, or JMHCP, in the Policy Office at the Bureau of Justice Assistance, like we call BJA. I come from many of the community programs you represent at the state and local level, where I, too, look for solutions while working with people with mental illnesses and co-occurring disorders. And now at BJA, I work in the Policy Office, and I oversee a number of programs pertaining to the intersection of substance use and mental health with the criminal justice system, including the JMHCP and our law enforcement work. We are a small staff dedicated to translating best and promising practices into quality policies and programs for the criminal justice field. Also within BJA is the Programs Office, and the Programs Office manages the individual awards that each of you have received. And as such, you have been assigned a grants manager, either Nikisha Love or Veronica Munson. Nikisha and Veronica will be your contacts within BJA who can answer all your questions pertaining to allowable costs, management of the award, and reporting. We work closely together to ensure that all JMHCP grantees remain on track with their awards. So now that I've said my hello, we have to recognize and acknowledge your incredible accomplishment in receiving this award. So I have to add my congratulations. You have succeeded in securing grant funding in a very competitive year. Your applications were screened for basic minimum requirements, were reviewed, rated, and scored by panels of external peer reviewers, and after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding, so congratulations. We had a new grant category this year to focus on strategic planning for law enforcement to develop police mental health collaboration. A special welcome to the new law enforcement agencies, and we are so excited to be working with you. As recipients of this award, you each share a common goal to effectively serve people with mental illness in your local jurisdictions and to create positive system-wide change for people with mental illness in the justice system alongside many other professionals across the nation. So a little bit about our expectations of you. Since each program was reviewed and selected based on criteria that uniquely qualifies them as most competitive, I want to lay out some very specific expectations that we have of you. We expect that you will think about how your systems can be more responsive to people with mental illnesses and co-occurring substance use disorders in the justice system, and that you will take on the planning processes in all of the grants with gusto and be excited to work with the TA provider on this. We are making a difference through this work and really through you and your work. You will use validated screening and assessment for mental illness, substance use disorder, and criminogenic risk. You will seek appropriate services and identify system gaps for serving people with mental illnesses, and that you will seek help when help is needed, and communicate regularly with your technical assistance coaches and with BJA staff, to include your grants program manager, also known as state policy advisor, or myself, your policy advisor in the BJA office. So your expectations of us. You can expect that we will support and assist you as you set out to enhance your systems and reach program goals. We want you and your staff to have the necessary tools to serve this critically underserved population for the betterment of communities where you live. Both the BEAT program staff and policy staff will be responsive to your inquiries as they arise, whether they are technical, about allowable uses of funds, changes in key staff, requesting no-cost extensions, or whether they are regarding key changes at the state, county, or local level that you foresee potentially impacting your program. We will provide quality technical assistance through the Council of State Governments Justice Center. And just a little bit about the Justice Center. The Justice Center is a technical assistance provider for JMHCP grantees. They have been the content provider for many instrumental publications on this topic for BJA for over 12 years. Just some of the reference material will be provided at the end of this webinar. Please take advantage of these excellent guidance materials as you launch your program. Each of you will have a TA coach assigned to you by the Justice Center, and we expect them to call you, email you, challenge you, and support you. Overall, considering everything shared so far, what we are trying to achieve is better outcomes for people with mental illnesses and co-occurring substance use disorders in the justice system. Specifically, we are looking to better identify people with mental illnesses in jail and improve access and connection to community-based behavioral health care. This includes important work to develop police mental health collaboration, work towards collaborative county and regional approaches to look at the data to decrease the number of people with mental illnesses in jails, and have systems think strategically and plan for diversion of people with behavioral health needs. That's a lot. We are excited for you to use data in your systems, develop evaluations, and track performance measurement through the performance measurement tool. Each program has worked hard to get together an advisor group and put together a great proposal, and we want to make sure you can share your outcomes with us and with the field. So with this brief introduction, I will turn it over to Dr. Richard Cho to talk a bit more about the CSG Justice Center, and you will hear more about this later. Richard?
Great, thank you, Maria. As Maria mentioned and Sarah mentioned, I'm Richard Cho, and I lead our behavioral health initiatives for the Council of State Government Justice Center. And just let me say what a great partner Bureau of Justice Assistance and Maria Fryer has been in helping advance the kind of data-driven strategies I think that are needed to really address the crises at the intersection of mental health and criminal justice. Maria already mentioned that the CSG Justice Center is the federally funded technical assistance provider for the JMHCP program. That's one of the aspects of the work that we do. We're a national organization, and we're a nonprofit and nonpartisan association. And our parent organization, the Council of State Governments, is essentially a membership association that responds to the needs of state government leaders across all three branches of state government. The Justice Center was founded as a subsidiary of the Council of State Governments in 2006, and our role is to provide practical advice informed by data and evidence regarding how criminal justice system policies can be smarter and more effective to improve outcomes for all people who are criminal justice involved, and our division focuses on those with behavioral health challenges. We advise governments at the local levels, at the state levels, as well as provide federally funded technical assistance. I just want to take a moment to echo Sarah and Maria and congratulate all of you in receiving your Justice Mental Health Collaboration Program grants. We're excited to both partner with you, provide technical assistance, and also to learn from you about the work that you're doing. Let me tell you a little bit more about the Behavioral Health Division. On the next slide. As I mentioned, both Sarah Wurzburg and I work in the Behavioral Health Division at the Council State Government's Justice Center. We, in addition to being the JMHCP TA provider, also play a number of other roles, including providing technical assistance related to helping support police mental health collaborations. As Maria mentioned, BJ has developed a toolkit to support the expansion of police and mental health collaborations and partnerships between police and behavioral health systems to better respond to people who are experiencing mental health crises who come into contact with law enforcement. We've also done consulting for a number of counties and jurisdictions to help them improve their criminal justice policies with respect to people with behavioral health needs, in particular for those with serious mental illnesses. We've also maintained a number of criminal justice mental health learning sites and provide a number of tools and resources that are both federally funded as well as those that are privately funded. One of our newer initiatives is the Stepping Up initiative, which we are co-leading in partnership with the National Association of Counties and the American Psychiatric Association Foundation. And Stepping Up is a national campaign that is calling on counties to commit to reducing the number of people with mental illnesses in our jails. As we provide technical assistance, you'll hear more about our work under Stepping Up as well as other aspects of what the CSG Justice Center does. And then in addition to being the federally funded TA provider for JMHCP, we also are the current technical assistance provider under the Second Chance Act, known as the National Reentry Resource Center. And one of the grant tracks for the Second Chance Act is grants that support programming and innovations for people with co-occurring disorders who are involved in the criminal justice system, which has many similarities to the work that all of you are doing through the JMHCP program. Next slide. Maria already provided a little bit of background on JMHCP, but I wanted to provide a little bit of a historical perspective. It was first authorized in 2004 through a piece of legislation known as the Mentally Ill Offender Treatment and Crime Reduction Act, or MIOCRA, and was back then signed into law with bipartisan support. The program is actually authorized at $50 million, but has been received actual funding appropriations. That is, Congress has actually funded this program at or around $9 or $10 million consistently over the last several years. We've been the technical assistance provider for this program from the beginning. And again, this program has continued to receive bipartisan support and has been reauthorized. Most recently, it was reauthorized under the 21st Century Cures Act, which in addition to funding a number of innovations related to behavioral health, also reauthorized the JMHCP program and the Mentally Ill Offender Treatment Crime Reduction Act, and has renamed that into the Criminal Justice Mental Health Comprehensive Justice and Mental Health Act, and also provided funding for both a national TA center for improving law enforcement responses to people with mental health, as well as more funding for mental health courts. These days, it's hard to find an issue that has more support from both parties, as well as across the country, and from both the behavioral health system as well as criminal justice stakeholders than this issue of the crisis of mental illness in the criminal justice system, in particular as it relates to jails. In the next slide, we've been tracking this issue closely over the last 20 or 30 years and feeling both a sense of pride in the innovation and hard work that's happening across communities to better respond to this crisis, and at the same time a sense of frustration that over the last 30 years we've continued to see this crisis becoming only more acute as more people with mental illnesses wind up in jails, more law enforcement encounters of people who are experiencing mental health crises, and often the outcomes not being what we'd like them to see, where law enforcement encounters result in either injuries to officers or citizens, or sometimes even more tragic outcomes, and that the outcomes for people with mental illnesses who end up booked into jails become worse. They spend longer than people without mental illnesses in jails, as well as have higher rates of recidivism. We are at a new moment, I think, in this country where communities across the country, such as your own, are committing to addressing this crisis and really taking some of the strategies that we've learned are effective to scale. And I think that's the political moment that we find ourselves in. And I think what I'm particularly excited about is that all of you as JMHCP grantees will have the opportunity to lead the country in helping not only identify and test out what works to better improve outcomes in terms of public safety as well as public health for this population, but also the opportunity to be able to scale up those interventions to have the kind of system-wide impacts that you see. So once again, congratulations from me, and I'm excited at the work we have ahead. With that, I'll turn it back to Sarah Wurzburg.
Thanks, Richard, for that great overview. So I'm going to put a little context into some of what Maria touched on earlier about the Justice and Mental Health Collaboration Program, as she'll talk more about, has a wide variety of programs, from programs focused on reducing the prevalence of mental illness on jails to developing police mental health collaboration programs to working on mental health courts to diversion programs and reentry programs. A common thread that we're really seeing is the development of behavioral health diversion strategies. And this slide is to acknowledge the fact that in different communities, diversion is defined differently. And people are talking about, reducing jail stays for folks. People are talking about anything. The broadest definition would be rerouting an individual out of the criminal justice into treatment services. So different jurisdictions are using different definitions for this. The goal of the work for JMHCP grantees and others in the field more broadly is to really have options for behavioral health, diversion, and reentry services within the criminal justice system. We'll be working on a web-based tool to assist in RTA to give some of these options and to develop strategies for multiple options for people with mental illness and co-occurring substance use disorders in the criminal justice system. This chart is a visual flow of how a person would go through the criminal justice system and where diversion can occur, which subparts of the system that there could be different initiatives from law enforcement to pretrial to courts to jails. And there's the differential between the pre-booking and post-booking diversion piece. Along with this, the really key part is the behavioral health diversion strategies include the important link to community-based services. This represents the community continuum of treatment services and housing available from outpatient treatment to supported employment to crisis services to peer support and case management. Along with these diversion strategies, and we're pleased that there's a new grant category that really focuses on the police mental health collaboration and the concept of law enforcement responses to people with mental illness. There's a lot going along in the country to address this, this for law enforcement, including the One Mind campaign as well. So for those law enforcement grantees who are Category 2 or Category 3, the Police Mental Health Collaboration Toolkit will be a great resource, as well as a framework that is being developed that really outlines key pieces of this that include leadership, protocol, training, resources, service coordination, data, and improving performance. So a lot of your jurisdictions may be included in the Stepping Up initiative, which Richard mentioned, and the focus of this work is to decrease the prevalence of mental illness in jails, and nearly 400 counties have stepped up to address this issue. And this is particularly an important piece of the technical assistance for the Category 1 grantees to really use a lot of the resources through this initiative and to walk you through some of the key pieces of Stepping Up. As I mentioned, some of the key resources is there's a document that outlines the 6 questions for county leaders need to ask in order to be able to decrease the prevalence of mental illness in jail. There's also the 4 key measures, which are meant to try to break down and simplify the hard work of reducing the number of people with serious mental illness booked into jail, shortening the average length of stay, increasing the percentage of connection to care, and lowering recidivism rate. As all you can see, there's key decision makers in every jurisdiction, and a lot of you will have these around the table through the coordination for your Justice and Mental Health Collaboration Program grant. Some of the primary challenges that we've seen through working with grantees in the field that we'll be working with all of you on are really addressing data across the system in all forms. Data-informed decision-making to identify people with mental illness in the criminal justice system is a really hard piece, and we're going to work with you to try to get accurate data collection and information. Another major challenge that we've seen in working with jurisdictions is identifying systems improvement and treatment gaps in the criminal justice system and the community. This goes back to the concept of behavioral health diversion strategies, which we look forward to working with you on. At the practice level, there's some additional challenges that we've worked with jurisdictions on related to targeting behavioral health needs and criminogenic risk for those who are further on in the criminal justice system, as well as incorporating this information into case planning. So as a result, in 2012, the Justice Center worked on developing a criminogenic risk and behavioral health framework that outlines the process for identifying people who are high risk, high need within the system, to focus on the criminogenic risk assessment, followed by substance use disorder, followed by mental illness, to really target the services to the people who are most in need. In order to fully implement this, we developed a web-based tool to support the case planning process for diversion and reentry. This really takes those concepts and breaks them down into how you can actually do this through addressing 10 key priority areas, as well as identifying a lead case planner, whether it be a behavioral health provider, person who works in a correctional facility, or community supervision. On the tool, there's 3 case studies that outline those different approaches. And for the lead case planner, it also looks at what information that they can get from others who are coordinating with them, and what information those folks should give to them. So this example is a wheel, and the colorful wheel identifies different supportive agencies, from peer support to courts to children's services agencies. And on the tool, you can click on each of these and you get additional information. I'm going to turn it back over to Maria to give a bit more information about the Justice and Mental Health Collaboration Program.
All right, great. Thanks, Sarah. So on to the program itself. Overview of JMHCP. The goal of JMHCP grant program is to develop collaboration across the criminal justice and behavioral health systems, from law enforcement, pretrial, courts, jails, and community supervision, to learn how to have successful partnerships that increase efficiencies, improve public safety and outcomes for people with mental illness in the justice system. Next slide. There has been $98.4 million in JMHCP awards to improve public safety and responses to people with mental illnesses in the justice system. In FY17, we have 55 new grant awards. Next slide. There have been 433 awardees from across the nation, representing 49 states and 2 U.S. territories, American Samoa and Guam. Next slide. As I mentioned, this year there are a total of 55 new grantees, 7 Category 1 collaborative county grantees, 25 law enforcement strategic planning grantees, and 22 implementation and expansion grantees. Next slide. There are 3 categories of grantees in JMHCP, Category 1, 2, and 3. Category 1 is Collaborative County Approaches to Reducing the Prevalence of Individuals with Mental Disorders in Jail. And the grant amount is up to $200,000 for 24 months. In Category 2, our new category, Strategic Planning for Law Enforcement, is for 12 months and is a grant amount up to $75,000. And then there's Category 3, which is Implementation and Expansion, and it is up to $300,000 for a grant project period of 24 months or 2 years. Next slide. So a little bit more about Category 1. The collaborative county grants are planning process initiatives with county leadership toward the goal of reducing the number of individuals with mental disorders and co-occurring substance use disorders in local jails that can be safely supervised and or treated in the community. This follows the 6 questions and the 4 key measures that Sarah mentioned earlier of the Stepping Up framework. The goal is to have jurisdictions be able to identify how many people with mental illnesses are in their jails, work to develop strategies to identify people, refer to services, and think through a system-wide response. Next slide. Category 2. The new Category 2 Law Enforcement Planning Grant is something I'm really excited about. This is a lot of the version we mentioned earlier. Agencies will be provided practical and actionable written guidance drawn from the successful experiences of law enforcement to design their police mental health collaboration strategy. The grant you will work on involves an action plan called a planning guide that we will go over. Sorry about that. A commitment of leadership and collaboration with behavioral health agencies that include written policies and procedures, necessary policies and mental health resource allocation, training curricula and practices, staffing and performance evaluations, and the use of data for performance outcome measures. Next slide.
Hey, Maria, you cut out slightly during a couple of those. You don't need to repeat because I think we got the gist of it, but just to let you know that there was a couple of wavering moments.
Okay, and so on with Category 2. I'm not sure how much cut out, but again, this involves the commitment of leadership, collaboration with behavioral health agencies, written policies and procedures, necessary police and mental health resource allocations, training curricula and practices, staffing and performance evaluations, and the use of data for performance and outcome measurement. Hope everybody heard that. Okay, next slide.
That we heard perfectly, so I guess
Great.
You know it worked.
Wonderful. Okay, Category 3, Implementation and Expansion. This category of grantees have folks from all across the justice system represented, the entire, from beginning to end. This is what we consider our
Hey, Maria, this time, sorry, Maria, this time it's cutting out a little bit more, so if you don't mind starting from the beginning for this slide would be helpful.
Sure, thank you, sir, for letting me know. So implementation and expansion grantees, these are folks from across the justice system, and this is what we consider our bread and butter of all the work that we've done over the years. All the grantees are working toward developing diversion and reentry strategies for people with mental illnesses and co-occurring substance use disorders. We will encourage you to think of this at a systems level again, not just about the program or the targeted number of people you propose to serve, but more in terms of a system-wide approach. Next slide. Okay. The Category 3 grantees provide training, access to health care, and other services, law enforcement, pretrial, courts, jails, and community supervision focused on the best practices for diversion, case management, and reentry. Okay, I think I've covered it. Now that you've heard a bit about your fellow grantees, I'm going to turn it over to Nikisha Love from the BJA Program Office to provide some budget and grants management tips.
Thank you, Maria. Hello, everyone. My name is Nikisha Love. I am the lead grant management specialist for the Justice and Mental Health Collaboration Grant, and I would like to say congratulations to all of the new recipients with BJA and Veronica Munson. We're going to do an overview. We're going to speak in reference to, I'm going to go over special conditions, reporting, financial information, unallowable costs, subawards, subrecipient monitoring, the FFADA, which is the Federal Reporting Requirements, excuse me, grant adjustment notice, grant monitoring compliance, and any additional information and resources. GMS, this is the Grants Management System. This is a system that you should become very familiar with. This is the web-based data-driven computer application that you will be using to process any grant adjustment notices, submit your financial reports, and your progress reports, and all of the closeout processing. Post-award actions. It is very imperative that you carefully read all special conditions. Any programmatic withholdings and financial withholdings, any questions that you have should be directed to myself or Ms. Veronica Munson. Should you incur any expenses prior to the start, that will not be approved. Approval is required. Also, please become familiar with the OJP Financial Guide. I'm telling you, it will be your best friend. You are also required to complete the grants financial management training within the first 120 days of acceptance of your grant award. Next slide. Special conditions. Before I really go into the special conditions, I would like to say that there are still a few of you that have not accepted your grant. So please do so. You have 45 days from the date of the grant award to do an award acceptance. If you notice that you're coming down to the end and it will go past the 45 days, please reach out to myself or Veronica Munson to let us know that your intent is to accept the award, but you are requesting additional time. Special conditions. The special conditions are very important. When you receive your award, you have to read, and the authorized representative will sign off an initial on each of the special conditions. Please become familiar with the special conditions, as there are some that have withholding. Next slide. This is what the special condition page looks like. So this is what you should become familiar with. You should have numerous pages of the special conditions, and most of the ones you want to really pay attention to are the ones that have withholding special conditions that will need to be addressed. Next slide. All awards include the standard special conditions, which are the DOJ Grants Financial Guide. As I said, please become familiar with that guide because it will be your best friend. The use of federal funds, audit requirements, Anti-Lobbying Act, civil rights, EEOP, reporting potential fraud, waste, and abuse, and those are just a few. This year, for the FY 2017 Justice and Mental Health grant application, there was a withholding place for the program narrative, which includes the opioid abuse reduction that everyone must address. So you will see, again, if you look at your special conditions, this is a withholding on your program narrative to address the opioid abuse reduction. Once you accept the award, once you have accepted the award, please contact myself or Veronica Munson so that we can give you additional information on what is needed to remove this withholding special condition. For categories 1 and 3, you also have a partial withholding of funds for the planning and implementation guide. Once you've completed your guide, all of your funds will then be accessible to you. But until then, you will only receive up to $100,000, and that's only on an approved, if you receive an approved budget. And all other programmatic withholdings have been removed as well. Next slide. Progress reporting requirements. The PMT is a quarterly report that you will have to submit, and that is the performance measurement tool. That is quarterly, that is due every 3 months, and it gives you the due date. Semi-annual reports is the GMS report. This is the report that you have done in the PMT that you will submit into GMS. Now, the only time that you are required to submit within the 3 months during the quarterly period is the first, from October 1st through December the 31st, excuse me for that you will have to submit that GMS programmatic report. But after that, every report from there will be semi-annual. If reports are not submitted on time or by the date, a hold on your funds will automatically apply for delinquent reports. Next slide. Financial status reporting. These are due quarterly in GMS. Even if you have no activity, you are still required to submit these reports, which will be, as you can see, if there's no activity, you enter 0. And if you have any issues or questions, you can contact the OCFO Customer Service Desk, and they will assist you with any questions that you may have regarding filling out the financial status report. But again, even if you have no activity, you are still required to submit those reports within the 30 days of the due date. I'm sorry for that. For FADA reporting, this is the Federal Funding, Accountability, and Transparency Act report that is required of all grantees receiving grant funds, that they must submit this report for any sub-recipients, sub-awards, and when we go into that, anyone that you have a contract with, anyone that you consider a consultant that gets directly paid with federal funds for $25,000 or more, at the first tier, you must submit the FADA report. There's information that you can go on to get familiar with the website, but this report is a must that you have to submit. Next slide. Again, important reminders for submitting your financial status report, which is your 425. Report actual funds spent, not your drawdown amounts from the federal government. Report from the recipient level. Make sure you put in the correct match requirement. Any program income that has accumulated that you have not submitted, that you will need to submit. If you need to report correct indirect cost rates, please make sure that is included. Report correct indirect cost rates, provisionals, finals, or fixed. Report for every quarter, regardless whether or not expenses were incurred or if you had any activity. Please make sure that you submit those reports quarterly, because if you do not submit that report quarterly, there will be a withholding of funds placed until the report has been submitted. Next slide. Okay, we're going to do an overview of the financial information where the recipient agreed to read and comply with the financial and administrative requirements set forth in the DOJ Grants Financial Guide. Like I said, please get familiar with your financial guide, because it will become your best friend. There you will learn about allowable costs, unallowable costs, all costs that affect your project, and any funding statute requirements. This is the place where you get the guidance you should refer to from your original solicitation. When you just have questions and you just, don't know where to go, the guide will become your very best friend. Next slide. Grants Financial Management Training. As I had stated a couple of slides back, that this is a requirement for point of contact and financial point of contact. So for all point of contact and all financial point of contact that are listed in GMS, you have to complete the training within 120 days of award acceptance. So the date that you accept the award, the point of contact and the financial point of contact have up until 120 days to complete this training. This training is web-based and it's also in person. So it's up to you to figure out what works best for your organization. Okay. Financial information and resources for, like I spoke in reference to the financial guide. This is the link to the financial guide. If you need to go to the Office of Management and Budget Uniform Guidance, this information is also linked there in OJP websites for any FAQs, anything that you have on the uniform guidance, that information has also been linked for all of the web addresses. Next slide. Okay. Unallowable costs. Unallowable costs under the Justice and Mental Health Collaboration Program Awards. As you can see, there are a few, and this is just a few, where you have prizes, rewards, entertainment, trinkets, monetary incentives, client stipends, gift cards, vehicles, costs that do not support approved project activities, entertainment, food and beverage, costs incurred outside of the project period, and program-specific unallowable costs. Now, although you have prizes and rewards and entertainment, and we also came down to entertainment again, because most of the time we find that you all want to, give certain rewards to your participants or to your clients, and that has a monetary value can be sold. So this is why we say this is an unallowable cost. Anything that can be sold or that can purchase things that are unallowable, like food. If you give a gift card, they can go out and purchase food. They can go out and purchase alcohol. So this is why we say this is unallowable. So again, please make sure you become familiar with this and read the financial guide. Next slide. Additional guidance this is for subawards and contract information. If you're trying to figure out between a subawardee, a subrecipient, this is the information. These are the links that you can go to for that. Next slide. Okay, selecting and monitoring subrecipients. Selecting and monitoring your subrecipients. As a requirement of your grant award, when you signed off on it, that you all have agreed to monitor all of your subrecipients on a regular basis. So although you may not be doing direct services, you may have the direct services being contracted out, you are still required to have policies and procedures in place, that you have to go out and do checks, that you are, the same way we come out and do our monitoring, you all are required to do monitoring as well. Next slide. Grant adjustment notices. The grant adjustment notices, as we call GANS, are found in the GMS system, which is the grants management system. Here you will be able to go in and do budget modification, a change of scope if needed, request a project period change, point of contact information. Now let me really rely on this point of contact information. This is really imperative to the success of your grant program. Anytime that you get a new employee or someone leaves and someone is coming on to take over this position as being the point of contact or the financial point of contact or the authorized official, it is required that you have to update the new information in GMS, because this is our way of contacting you all through GMS. In the event that I leave and someone else comes on, they will need to be able to get in contact with you all. So all contact information needs to stay updated. And this is also in your special conditions as a requirement that all point of contact information stay current. Removal of special conditions. Now, removal of special conditions, you all cannot, let me say that again. The grantee cannot submit a GAN for removal of special conditions. If you have an active special condition, you have to submit all documents to either myself or Veronica Munson to have that special condition removed. So you cannot go into GMS and create a GAN to say, I wanted to submit this to remove this special condition. No, you will have to contact myself or Veronica, and we'll give you instructions on what documents need to be submitted, and then we will submit the GAN to have those special conditions removed. Sole source GANs, if you're looking into doing a sole source, there's information in the financial guide on how you can go about creating a sole source GAN. Cost required, requiring prior approval. Now, we don't get too many of those, but just in case if that comes up, then you will have to go into GMS, and please become familiar again with the financial guide on what information is needed to get cost requiring prior approval. And GANs will not be approved if the grantee is delinquent on financial or programmatic reporting. Let me say that again. If you submit a GAN and you have not submitted your financial reports or your programmatic reports, your GAN will not be approved because you are delinquent on submitting required reports. Also, if you have active withholding special conditions, GANs cannot be approved until those active withholding special conditions have been addressed and removed. Next slide, please. Change to project scope. Prior approval is needed when changes include altering programmatic activities, anything that affects the purpose of the project, change to the project site, change to the target population, and changing the sub-grantee or contract, which means, like I said, you may have a contract and you may have a consultant. So what we consider to be a sub-grantee or a sub-recipient will be, again, your contract or your consultant. So anytime you're making changes to those, you will have to submit a project scope. Before doing anything that really affects the scope, we suggest that you work with your TA point of contact at CSG just to make sure that whatever you're doing works best for your program. Next slide, please. Budget modifications. Budget modification GANs are submitted when you want to revise your budget, because as we all know that most budgets are guesstimations when you first submit them. So you're guessing that this is what all costs will be, and then until actually you're working in the program and you're now submitting invoices, so therefore you may need to come in to revise your budget. A budget modification GAN is needed when a budget adjustment affects a cost category that was not included in the original budget, which means that once you receive an approved budget, and let's say you didn't have any cost in other, and now you want to come in and you want to, move some money from supplies and put it into other, because that was not an approved cost during the original budget. You will have to submit a budget modification GAN. And if you come in and zero out a category that was prior approved, you will have to come in and submit a budget modification GAN. Any change to the indirect cost, if we've already approved your indirect cost and you want to come in because you have a new indirect cost rate, then you want to change the rate. Now, just because the rate changes that doesn't mean the amount of money changes because the money stays the same. So which means you will probably have to work with a different category during that cost. There is a 10% rule. Now with the 10% rule, that this is only on approved budget cost categories. If you've already received approval on these budget cost categories and you just want to move money between approved categories and it's within that 10%, although a budget modification GAN is not needed, but for grant purposes and for audit purposes, and then when I say audit purposes and for record purposes, I'm saying that in the event that you leave your organization or I leave the organization and someone else comes in, you want to have some type of documented trail. So what I suggest, I'm not saying that you have to because Veronica may not want you to, but what I suggest is that you submit a program office approval GAN. That way, if you leave or someone has to come in behind you or I leave, someone has to come in behind me, there is a record of this transaction. Now, this only affects awards that are not less than $100,000. So if your award is less than $100,000, then you will have to submit a budget modification GAN. Again, please become familiar with the DOJ Financial Guide. As I said, it will be your best friend. Next slide. BJA compliance monitoring. As I had spoke of, you all happen to go out and monitor your sub-recipients the same as BJA. We have to come out and monitor you whether we come out on site or we do over-the-phone interviews. Now, myself, Veronica, or any BJA representative may want to come out and see you. And as a condition of your award, when you agreed and you signed, this is a condition, and this is imperative that you all become familiar with, that I can come out at any time, OCFO can come out at any time. You agree to this, so please become familiar with it. For any additional information, you have the BJA main number, the BJA website, and any BJA funding opportunities, any current funding opportunities, any FAQs concerning BJA funding. All of that information is there. My information is linked, and Veronica's information is linked for those of you who are Veronica's grantees. Again, I would like to say congratulations on becoming new Justice and Mental Health grantees for the FY17. I look forward to working with you as well as Veronica Munson. At this time, this concludes my review, and I will turn it over to Cassandra Carter, who will speak to you all in reference to the the PMT.
Thank you, Nikisha. Hi, my name is Cassie, and I provide technical assistance related to the PMT specifically, also referred to as the Performance Measurement Tool. Today, I will provide a brief overview of the PMT, including how the tool is used, and review the reporting schedule. We provide technical assistance with data entry, providing annual trainings, assisting grantees and giving them clarity to the performance measures in which they are to report on, system navigation, and we also send email correspondences reminding you of when the PMT is open for reporting. The PMT is a tool that is designed for grantees to provide data on program activity. You can access the BJA PMT by using the URL www.bjapmt.ojp.gov. The platform provides ongoing data collection to determine if a program is implementing their activities and achieving their objectives. It measures inputs, outputs, and outcomes over time. Once you've been added to the PMT, you will receive an automatically generated email with instructions on how to log into the tool. If you do not receive this information by the end of January, we advise you to call the help desk. The PMT collects data for a 3-month period of activity, referred to as a reporting period. Grantees have 30 days after the close of a reporting period to enter data into the PMT. After you complete your data entry, you will be prompted by the PMT to create a report of this information. It is important that you submit your data into the GMS in January and July of each calendar year. Completed data reports are always available in the PMT for you to create and save as many times as needed. And if you look at this slide, you can see the PMT reporting schedule. You see there's a quarterly and a semi-annual schedule that you have to report on, and you must submit the report from the PMT to the BJA GMS tool as an attachment through GMS. Nikisha has already reviewed the PMT reporting schedule, but you can use this box for reference. The reporting schedule details the time frame for each quarter, the type of data that grantees need to submit, and the due dates for submitting it in the PMT and in GMS. Grantees will enter program performance measures every quarter and enter the narrative section twice a year during the April to June and October to December reporting periods. This coincides with the semi-annual GMS reporting requirements. GMS is where grantees will upload the PMT report. Lastly, I would just like to go over a frequently asked question, which is the same for the financial reporting. You are still required to fill out a report in the PMT if you have no grant activity. This was a brief overview of the PMT. However, we will have a separate training that is dedicated solely to data entry and system navigation, and those training dates are coming soon. If you'd like more information about the performance measures themselves or the type of assistance that the PMT Help Desk provides, you can email bjapmt@usdoj.gov or call at the number provided on the slide. And now I'd like to hand it back to our moderator. Thank you.
Thank you, Cassie. We appreciate that important information and the level of detail you were able to provide on the performance measurement tool. So I am going to talk a little bit about training and technical assistance that we're able to provide to grantees. So in order to break this down, we kind of tried to simplify it a little bit. So each of you, as Maria mentioned, will be assigned a TA provider or technical assistance coach who will work with you for the entire grant period. So for some of you, the year planning period, for some of you, the entire 2 years of your grant. We also provide peer learning opportunities for you all to connect with each other, to connect with past grantees and other current JMHCP grantees of different years. We provide resources and tools from webinars and trainings around the country to things that have already been developed that will be helpful. Some of the things mentioned today, like some of the Stepping Up resources or the police mental health collaboration resources. We also are able to provide access to experts in various ways. Each technical assistance provider will be getting to know you and your jurisdiction and really try to get a feel for what your needs are in order to best be able to implement the programs that you propose. We call this targeted technical assistance. It'll include monthly calls for every grantee, so you get to talk to your TA provider monthly. the planning and implementation guides, or for the Category 2, which are planning grantees, we're calling it a planning guide instead of planning and implementation. Different resources, also national meetings, which will include a strategic planning meeting for some of you, as well as a national conference. And then site visits, which we're not able to do for every grantee, but some of the grantees will have the opportunity to have a site visit that can include help with doing your planning and implementation process, as well as different training opportunities, or to help facilitate some of the complex conversations that are going on in your jurisdiction. So for those of you new to this process, you might be asking, what can you ask your technical assistance provider for help on? So there's a bunch of different stuff we're able to help with. We will help you walk through the planning and implementation guides or the planning guides. We have a lot of experience through our years of technical assistance on strategies for engaging new stakeholders, or taking the work from individual programs to really engaging people at the systems level, including leaders in your jurisdiction, such as county commissioners. How to identify goals, how to define who the folks are that you are surveying, including defining, mental illness for your system, substance use disorders, thinking through data collection, performance measurement, and program evaluation, as well as how do you sustain your program. You can do this through the monthly calls. There are also other webinars that we provide that will be available, and different supporting resources and publications that we can send you and work with you on. So really we're here to help with the questions that you have, and if your TA provider can't answer them, they'll try to work with someone who can answer them, whether that be an internal expert or an external consultant. So peer learning is a really important part of the Justice and Mental Health Collaboration Program, and something that we know all of you look forward to. Is everyone always wants to hear about another jurisdiction that's already implemented what they're trying to do. We do this through a bunch of different mechanisms. We have some learning communities, which are opportunities for people to get together to talk about different things, such as data collection and evaluation. We also, as part of the law enforcement Category 2 grantees, will have a series of webinars that will be focused on peer learning. We're able, as I mentioned before, to connect you with past and current grantees. We also have learning sites. There are learning sites for law enforcement, and then there's also mental health diversion learning sites. So these are best practice sites around the country who've agreed to answer questions and have really set high standard for what they do. Peer learning is also available at the national events. So for Category 1, the collaborative county, and Category 2, the law enforcement planning, you'll have strategic planning meetings where you'll meet your cohort, and then at the national conference, you'll be able to meet people across different grant years through the Justice and Mental Health Collaboration Program. Some of the resources and tools we have were already mentioned today. The planning and implementation guides themselves are a resource, and there's a whole list of resources involved with them. There's also publications. There's things like we have a resource to help develop mental health courts. We have resources through some of our initiatives that we previously mentioned for PMHC and for Stepping Up. So there's lots of stuff out there, as well as other organizations' resources that will provide on upcoming webinars and events that you might be interested in. For access to experts, this can happen through phone calls. In some cases, we're able to bring an expert on a site visit. At the national trainings, we'll have different folks from around the country, including experts who are federal government officials, researchers, and people who are well-known in the field. So that's a great opportunity to access experts, really to be able to bring questions for some of the folks that you've been wanting to connect with. And then also, the learning communities and the webinars will also have experts on them who will be able to help answer your complicated questions. So as I have alluded to, we have the grantee orientation, strategic planning meetings for Category 1 and 2, and then a national conference for Justice and Mental Health Collaboration Program. I've already received questions about what the dates are for these, and I just wanted to let you know that the dates have not been confirmed yet, but we will certainly let the grantees know once they have been confirmed. One additional way where you can get resources is we have a monthly behavioral health newsletter, and you can see on the top of the page it says subscribe, and you can subscribe to that to also get some additional resources in addition to what the TA providers are able to give to you. So now we have some time for questions and answers. And I'm going to introduce a couple of my colleagues who are going to be help facilitating the question and answer session. We have Will Engelhardt, who's a Senior Policy Analyst in the Behavioral Health Division at the Council of State Governments Justice Center. He's the lead for the Category 1 Collaborative County Grants. We also have Nikki Smith-Key. She's also a Senior Policy Analyst, the Law Enforcement Team in the Behavioral Health Division at the Council of State Governments Justice Center, and she is the lead for the Category 2 Law Enforcement Planning Grants. So thank you both to them for joining, and you'll definitely hear more from them on those orientation webinars for Category 1 and Category 2.
Hey, so this is Will here, and we had a question for Nikisha from a grantee, and the grantee said that their county team had already completed the Department of Justice financial training and wanted to know if they could submit their certificates to someone specifically and if they could use those certificates as well.
Okay. If it's been done for 2015, no later than 2015, then that's good. That's fine.
And who would they submit it to? Just to their BJA grant manager?
Whoever their grant manager is, if it's myself or Veronica, and we can go in and look just to make sure that the POC and the FPOC are listed in our system as completing the training.
Great, thank you. So they didn't say what the year was, but if it was after 2015, that should work.
Yes.
I know Sarah has already mentioned the date not being confirmed for the conference, but we did get a question as to whether or not we have at least some indication of the month that the conference will be held.
So that's a great question, and unfortunately we don't have a date confirmed yet. You know, I think some people were concerned from those that I've been able to connect with that it would be really early in the year and they'd have trouble getting travel approval. Right now, some of the dates that we're looking at are a little bit later on in the year, so between April and July. So just wanted to make sure that people at least had that information so that way you weren't worried about having to get travel approval right away.
So we have another question for Nikisha as well, but some folks from the Justice Center could also weigh in on this. It's a question from a grantee saying that they already know that there are some elements of their programming that might be changing. Should they contact their technical assistance coordinator or someone at BJA? And if at BJA, who should they contact?
Well, they would need to contact whoever their state policy advisor is, which would either be myself or Veronica.
And in all likelihood, if they're changing the elements of their programming, would they need to do an adjustment as well to their grant?
No. Let us speak with them first, and then that way we can connect, because we have to make because we're going through a whole process, so therefore we need to make sure that everything is in line, because they're still withholding special conditions, and then, you know, we may have to link up with their TTA provider and policy.
Yeah. To what Keisha was describing. That's exactly right. Can you hear me?
No, we're not hearing you. Just a bit.
Okay, let me just say that again. How is it now? Better?
Yeah.
So just good. Just to add to what Nikisha was saying, she's exactly right. Because there's a lot of things happening right at the onset. There's, you've got withholdings perhaps on special conditions. We've got to take care of that. And then we do need to talk about if something programmatically is going to change, how that's connected to the dollars. So, in terms of potentially a budget adjustment, and then keeping you within scope and looking at goals and objectives and making sure that everything kind of moves along together. You do have to kind of orchestrate between programmatic and the budget piece, and then also making sure that, technically everything's up and running as far as the requirements for grants at the very beginning. So sometimes it can involve a group discussion between state policy advisor, myself, and policy, and the TA provider. Sometimes we can all get on the phone and work that out.
Great. We have another question coming in. How will I know who my TA provider is, and how do I get in touch with that person? And a second part to that question, who should we have join the TA calls? And I'll ask Sarah to respond to that.
Great, thanks so much, and what a fantastic question. I'm actually going to ask Olivia to go to the next slide. So each of you should have received an email that we're actually going to have a second set of orientation webinars that are more specific to each of the grant categories. Due to the different variance in requirements and the diversity, we want to make sure that everyone has a chance to answer their questions, as well as to go through the planning and implementation guides more thoroughly. So wanted to make sure everybody knew that we have these webinars coming up on the 7th for the law enforcement planning grantees, or what we'll call Category 2, the 9th for Category 1 collaborative county grantees, and Tuesday, November 21st for the implementation and expansion grantees. So to go back to answer the question, how will you know who your TA provider is? The TA provider is going to reach out to you via email. So you shouldn't expect to hear from them before these webinars take place, but they'll send you an email and introduce themselves and they'll let you know that they're your TA provider and that they look forward to working with you. So thus far, you haven't been assigned a TA provider, but they will notify you soon of that. And the second piece was who should be involved on the technical assistance calls. And this is a really great question. So to begin with, it's always a good idea to have the key people who are going to be involved in the process over the grant period on the first call or the introductory call. So that way everybody understands what the training and technical assistance is about and how to access it, as well as to make sure that those key stakeholders are involved in the process. So who for each of the grant categories might be a part of that may look slightly different, but really the focus of this grant is mental health and criminal justice collaboration. So we really want to make sure mental health and criminal justice partners be involved in that call, whether you're a court, whether you're law enforcement, whether you're a jail or community supervision, making sure you have people from both of those partners on. And then for the first call, we definitely recommend having a broader group so everyone's on the same page. Also, so your TA provider gets to virtually meet the team that will be involved in the process.
Great. So we have another question for Nikisha, which Nikisha had touched on a bit, but when does BJA anticipate that the grantee will receive their budget approval?
Budget approval right now, OCFO is still reviewing budgets. So we're hoping that they will be completed before the holiday period. But we just never know because a lot of the applications came in after cutoff period, and I know that they're swamped with reviewing a lot of budgets for BJA, and not just BJA but OJP altogether.
Thank you, Nikisha. Another question coming in. How can Category 2 sites do strategic planning if BJA isn't going to conduct the training until spring 2018? can we get BJA's preferred logic model format or content now in capital letters so that we can get started? And I'm going to ask Cynthia to take that question, please.
Thanks so much, Nikki. This is Cynthia Kimmelman-DeVries. I'm a Deputy Program Director here at the Justice Center. So actually for the law enforcement grantees, we are already talking about having the strategic planning meetings be earlier than the spring. We can't give you guys a specific date just yet because unfortunately there is an approval process that we have to submit to the Department of Justice and Office of Justice Programs who approves all of these things. So we are talking about having that event happening earlier in the year, so sometime in the late winter, probably closer to the February-March range rather than April, May, June. That being said, however, the law enforcement team, Nikki included, has done an expert job of putting together a new planning guide for you guys that will contain the logic model and format to take you through the strategic planning process that will be available to you much earlier than that, and that they will start working with you on when you start having your monthly TA phone calls. So while we might not be able to have the event much earlier than late winter, you will be able to start your work right away, and that's what your TA coordinator will help walk you through.
Thanks, Cynthia. The next question was just a question about the upcoming webinars and if they're the same as this one or different. And I can just very quickly take that, and Sarah had touched on it as well. But there is an upcoming grant-specific webinar for the Category 1, Category 2, and Category 3 grant tracks, and they are all specific to the specific expectations of those grant tracks. So they will be different, may touch on some similar requirements, but they are in more specificity to those particular grant tracks, and we hope that you can make that one as well.
Thank you, Will. One question, are there 2 trips that will be required by grantees to DC, and do the webinars take the place of 1 trip? And I'll ask Sarah to respond to that.
So within the grant solicitation, it does require 2 trips for a strategic planning meeting and a national meeting as well. So as of right now, that would still be the requirement. The webinars are an added form of technical assistance. They don't take the place of those in-person meetings.
Thank you, Sarah. Another question regarding the P&I guide, or in the law enforcement case, the planning guide. Do we work on that on our own? How long does it take? And who do we turn it into when we are done?
Great question. So those guides are something that you'll work on with your technical assistance provider, and that you'll go over on those monthly calls that you have with them. And the process for submission will be after you've worked to complete the planning guide or planning and implementation guides with your technical assistance provider. That will be submitted to your grants manager at the Bureau of Justice Assistance, so either Nikisha or Veronica would then receive those, and then they will go through the process of approving those as well. So that's what the process looks like, but you won't be on your own to complete the planning guide or the planning and implementation guide. You'll have a lot of supports. That's what TA providers are here for, to answer your questions and to help walk you through the process.
Thanks, Sarah. We have another question for Nikisha from a grantee that noted that they've already accepted the grant award, and they wanted to know if there are any special withholding conditions on the grant. How would they know that, and how would they be informed?
Okay. Yes. As I had stated in one of the previous slides, that there is a withholding special condition, not just on specific programmatic, but financial, because, again, a lot of the budgets, if any budgets have been cleared, there's probably 10% out of 100, but have not received a budget approval, so therefore they're still withholding on those. And if you read the special condition pages, you will see the special conditions, and it's mostly towards the end of the special conditions where you will see the actual withholding. And like I had stated, with the program narrative, there is an active withholding on that because you have to address the opioid abuse reduction.
Thanks, Nikisha.
Mm-hmm.
I think Nikisha had already answered this one, but I'll just ask you to reiterate, Nikisha. We have a different point of contact than when we wrote for the grant project proposal. How do we notify BJA about this change?
Okay, so you can either reach out to myself if I'm your grant manager or Veronica Munson, so we can see exactly who's listed in GMS and who will be the new point of contact, and we can give them instructions on what they need to do to be able to go into GMS to change that point of contact information, depending on which contact they're referring. Is it the point of contact, the authorized official, or is it the financial point of contact?
Hey, Nikisha, and we have one additional follow-up question from that withholding conditions question, which is just how would they be notified if special conditions are removed? Would it be through GMS only, or would they get some sort of email notification?
Yes, if they're listed in GMS, that's why we said it's very, like I said, it's very important that the point of contact information stay active in GMS, because any changes that go through GMS as far as GANs that are submitted and approved, GMS will send you an automated notification letting you know that once you submit the information that we request from you, myself or Veronica, to have those withholding special conditions removed, and once they receive approval, GMS will send an automated email letting you know that this GAN number has been approved. And I also do courtesy emails to let the grantee know that that removal has been done.
Thank you.
Okay. Well, I think that is all the questions we have for today. So I want to thank Richard Cho for his participation, Cassandra Carter, Maria Fryer, Nikisha Love, and also on behalf of myself, we'd like to thank you for attending the webinar and just reiterate our congratulations and how excited we all are to work with you over the next year to 2 years to implement the Justice and Mental Health Collaboration Program grants. Have a good afternoon.
Thank you.